Hey everybody, it's Dr. Falcone from Dignity Integrative. Hope everyone's having a great day today. We are going to talk about SIBO, or small intestinal bacterial overgrowth, which is actually a very common condition. It's been interesting. One of the reasons I'm talking about it is, I've been in practice officially in my integrative practice just under a year, and probably about 15% of my patients that I'm seeing actually have some significant GI issue that would be classified as SIBO that actually needs to be treated to make them feel better. And we'll talk a little bit about, the potential causes and the root causes of it, as well as exactly what it is, how it affects your overall health, and how we typically approach the treatment for it. Excuse me. So SIBO is, just as the initials say, SIBO, which is small intestinal bacterial overgrowth. A simplified way of thinking about this is that the bacteria that we travel with throughout our entire life, for hundreds if not millions of years, humans have had bacteria that kind of come along with the ride from us. They're in our mouth, they're in our colon primarily, our large intestine, which is the last part of your GI tract, and they reside on our skin. And they're the normal bacteria that we just walk through life with. There is a thought that we have an equal number of bacteria to human cells in our body. So think about that. Anywhere from 30 to 40 trillion, the number keeps changing depending on what study you use. We have normal human cells. We have about exactly the same amount of bacterial cells that either reside on us or in our body. And the majority of what resides in our body is in our large intestine. We can have hundreds of millions of what are called colony-forming units, CFUs, per gram in our stool, in our colon, huge amounts. Now, what happens with SIBO is there's an overgrowth of these bacteria that normally stay in the colon, and they start moving north. So they go into your small intestine and eventually work their way towards the stomach. And when they overgrow and they ferment, because that's one of the things that these bacteria do, is they ferment foods and provide nutrients for us. They can actually cause symptoms like chronic bloating, gas production, pain. They can actually cause systemic symptoms like joint pain, brain fog, all the things that we think about, chronic headaches even, interstitial cystitis, irritable bowel disease. It's interesting that we believe that about 10% of the population has what's called irritable bowel disease. And we think a majority of these people classified as IBS actually have SIBO, actually have an overgrowth of abnormal bacteria that needs to be treated. And once treated, the symptoms of irritable bowel disease magically completely go away. So how do we approach it? Well, typically what we do is we'll do some stool testing. Anybody that comes to my practice and they complain of any significant GI issues, chronic constipation, chronic diarrhea, chronic bloating or indigestion, I will typically get a GI comprehensive stool analysis, which looks at the mixture of your good and bad bacteria. It looks at how you're metabolizing nutrients. It also looks at, do you have an overgrowth of really bad bugs that we really need to be aware of? And it looks for true parasites, tapeworms and those kind of things. And you'd be surprised at how many people are carrying around things with them. Some of them need to be treated, some of them not. But it's good to get that kind of comprehensive picture. So when people complain to me of SIBO or complain of GI symptoms, typically what they'll say is it's one of two patterns, right? They'll have either chronic constipation. I spoke to one woman and I was talking to her and I said, well, what's your normal bowel movements? Oh, she said about 2. And I said, oh, about 2 a day. No, she said about 2 a week. So that was her normal pattern of bowel movements. Well, that is chronic constipation. If you're not going to the bathroom every day, usually once or twice a day, having normal form stools, there's something wrong with your GI system. That is not normal. So there's 2 main kinds of SIBO. One is primarily diarrhea, or a mixed kind where you have diarrhea and constipation. That's about 70% of people. And then there is 30% of people that have pure constipation. So when we do the comprehensive stool testing, we'll see certain patterns in the stool, and we'll say, that's really out of whack, and they have the symptoms or potential symptoms of SIBO. And then we'll do one further test, and it's called a breath test. Because what happens with these bacteria is as they move north from your colon up into your small intestine and they start producing gas, they produce one of three types of gas. They'll produce hydrogen gas, they'll produce methane, or they'll produce hydrogen sulfide. We can actually check for two of those types of gases. We can check for hydrogen gas and we can check for methane levels on a breath test. So you actually get a kit in the mail and you drink a substance called lactulose, which actually triggers these bacteria to use it to produce more of these gases. Because what happens in SIBO is that there are certain foods, and they're typically foods that you can ferment, that these bacteria love to grow on. So they love these certain foods. They are things like high sugar content foods, even things like garlic and onions that are fermentable foods. Things like some of these artificial sweeteners sometimes can be a food source. They're called polyols. So there's this whole kind of diet called a FODMAP diet, which are specific types of foods that these bacteria actually like, which are a lot of the things that many of us eat on a regular basis. So what we do as part of this breath test is we have somebody drink a certain amount of lactulose, which is a fermentable sugar, and it kind of supercharges the bacteria. So they actually go into a high metabolic state. They start producing all of these gases, and we actually can measure these gases. Normally what you should see is very little hydrogen, very little and no methane in your breath test. But as we follow it out for 2 or sometimes 3 hours, you'll see increasing rates of either hydrogen or methane, and depending on the type of bacteria that's shown, we can then direct our treatment towards. So usually what we find is people have suffered with this condition for many, many years, and they may have other conditions. Another reason that I will commonly do this is people with chronic inflammatory conditions, chronic joint pain, people that have rheumatoid arthritis and other arthritic conditions, this chronic inflammation. Even if they have very little GI symptoms, then I will typically do a stool test on folks to kind of look specifically for that, because I've been surprised that, you definitely have something going on here that we need to look at. So we get the breath test back. The breath test is either going to be normal, where it's not going to show any hydrogen or methane, or it's going to show high levels of hydrogen or high levels of methane. The methane type is a specific type of, it's actually not bacteria. It's actually these organisms that have traveled with us for millions of years. They're actually called archaea. And how we treat methane-dominant bacterial overgrowth, again, not bacteria, is a little different than how we treat the hydrogen dominant. Those are getting into the details of it that you probably don't need. So there's 3 main ways to treat SIBO. The first one, where we always start, is diet, nutrition. We look at limiting the kind of substances that will allow these bacteria to ferment and continue to grow. So basically what we're trying to do is starve them by not giving the nutrients that they need. The second way that we can treat it is using herbal antimicrobials. And there's a wide range of different herbal antimicrobials that we can use that are basically plant-based derivatives of the chemical substances in a lot of plants that actually serve to kill those bacteria that have overgrown. We can also use antibiotics. There's an antibiotic called rifaximin. I tend to not use that. It's kind of like the antibiotic of last resort for a couple different reasons. Number one, it's ungodly expensive. And interestingly enough, the studies have shown in head-to-head comparisons with the antimicrobial plants and rifaximin, which is an antibiotic that basically stays in your system. It doesn't go out of your system. The results are actually pretty equivalent. They actually get the same success rates. So we start with diet. We try and gradually kind of not give them the foods that they need, which is pretty restrictive. It's a lot of things that a lot of us like to eat, and can be, in normal cases, very healthy for you. Again, things like garlic and onion that can be fermented are actually quite encouraging to these bacteria to use. So we have to restrict a lot of those foods, typically for a month or two, and then we gradually start adding back some, but we have to kind of keep other ones on the side. So that's the first way that we treat them. Dietary changes, nutritional changes. The second thing is we actually treat the overgrowth with antimicrobials, either plant-based or an antibiotic. And the third way to treat it is using what's called an elemental diet. What is an elemental diet? Elemental diet is basically a packaged liquid of all the nutrients that you need and none that the bacteria need. So you basically go on this elemental diet for about 3 weeks. That's all you eat. You don't eat any foods. You can have water and that kind of stuff, but it's essentially nutrition in a bottle for 3 weeks. That, number one, can be expensive. Number two, can be just distasteful. But it is incredibly effective at essentially starving the bacteria so they're not allowed to eat. So that's the third potential, be after dietary changes, antimicrobials, either plant-based or true pharmaceuticals, and then this elemental diet. And then it's all about repairing your gut. So in the process, what we'll do is we'll give you nutrients to help you repair your gut. Because a lot of times what's happened is because of this bacterial overgrowth, you've actually have lessen the ability for your body to metabolize nutrients as it normally does. So what you find is that there's all this damage to the lining of your intestines at the microscopic level, and we have to give you things to repair it. Things like glutamine, which is an amino acid that actually helps to repair the lining of the gut. Partially hydrolyzed guar gum, which acts as a coating agent. There's herbal bitters that we can give to actually help coat and repair some of the damage. So it's a whole comprehensive plan that we have in place to, number one, remove any offending agents, like the particular foods that feed the bad bacteria, give support and help repair your gut, to be able to repair the lining that may have been damaged in this process from the overgrowth. Obviously, treat the infection with antimicrobials, either plant-based or pharmaceuticals. And the other thing that gets damaged sometimes is the ability for you to have what's called peristalsis. What's peristalsis? Peristalsis is what the normal process of the intestines kind of moving food through your system. You eat a meal and 12 hours later or 18 hours later, it comes out the other end. So the normal process is, as you have these normal movements through the small and large intestine, you have these waves of compression and relaxation in your intestine that you're just not aware of, that kind of moves the food through. Now, some of the people with, a lot of the people with SIBO actually have damage to the nerves that actually allow the peristalsis to happen. So often we have to give them support for what's called a migrating motor complex, or the MMC. And that's part of your nervous system that innervates your gut that allows peristalsis, that we can then give you a supplement that can help with that. And sometimes, unfortunately, people need to take that long term if those nerves have been damaged to the point of not being able to be repaired. So that's kind of how we look at it. And we've had remarkable results from people with chronic GI issues. And a lot of people see a lot of really good doctors and a lot of good gastroenterologists and primary care physicians. A lot of them have not thought about SIBO as a potential cause that may really be the reason why you're having some of these other symptoms. And the three main reasons that we sometimes will see people come in, number one, the first one is, or the triggering event, if you will, for it. Number one is that they have had like a bad gastroenteritis, right? You've had a bad GI virus, either you were traveling or just you're here. That kind of wipes out your good gut flora, your normal bacteria, and then you get this overgrowth. So that's kind of probably the most common, is a bad GI virus that completely takes out your good bacteria, and the bad bacteria kind of overgrow. Other potential causes are high carbohydrate diets leading to, or high sugar diets leading to what's called SIBO, small intestinal fungal overgrowth. As part of the GI testing that we do, we actually also test for things like Candida overgrowth, which is a yeast which all of us have in our system. It becomes more prevalent in women. Certainly that can get yeast infections. You can get vaginal infections from yeast infections. And sometimes if you're getting frequent vaginal yeast infections, that can be a sign that you have SIBO, or small intestinal fungal overgrowth. So that's something else that can sometimes trigger SIBO. You actually can have both of those at the same time. And some of the therapies that we use to treat the SIBO actually treats the SIBO as well. So that's important for you to know. And, there are other things that can certainly cause SIBO. Heavy metal toxicity can sometimes damage the gut lining and cause damage to the overall functioning of the good and the bad bacteria. And another common reason for getting SIBO are people that have had major abdominal surgeries. So if you've had a hysterectomy, if you've had a colon procedure, the likelihood is that you've had what are called adhesions, which are basically scar tissue that develops after the surgery. It's unfortunately part of the normal process. And this can actually cause mechanical blockages or kinks in some of your intestines that don't allow, remember we talked about that normal peristalsis, the normal movement of food throughout your entire intestines. So that's another not uncommon cause for people that then go on to develop SIBO, is kind of the mechanical blockage of the normal flow of food through the GI tract after an abdominal procedure, like a hysterectomy, like a colon procedure. So that's another thing to think about if you're suffering from some of those symptoms. So I just wanted to give you kind of an overview of SIBO. It's actually a very, very common disorder. Surprisingly, I've been actually surprised at how common it is in my practice. The good news is we have a way of diagnosing it through GI testing as well as breath testing, that we can get a clear diagnosis, and that can direct our therapy. That in general is very, very effective. For some people, this is a lifelong adjustment that they need to make to what they're eating and the type of foods that they're feeding their good and bad bacteria with. But it is treatable. We've been very effective in treating it, and I just wanted to kind of explain a little bit about SIBO and how common it is and what effects it can have on you. So if you're interested in more information, please comment in the comments below. If you're interested in having a consult, feel free to ring us up at Dignity Integrative. We're also always happy to talk to new patients. Until we meet again, I look forward to seeing you. Stay safe, stay well, and take care. Bye.